As in my previous video, I have discussed about inflammation and its vascular events in our body. As we all know, inflammation has two types of events. One is vascular events and the second one is the cellular events. So in this video, I will discuss about the cellular events. So what is the definition of the cellular events which is occurring in the whole inflammation process? This process, the main motto of this process is to deliver leukocytes which are capable of phagocytosis. As we all know, the leukocytes which are capable of phagocytosis are neutrophil and macrophages, to deliver these leukocytes at the site of injury. This is the whole process of the cellular events. So what are the steps in these cellular events? The first one is the leukocyte recruitment or extravasation, and the second one is the leukocyte activation. So in this video, I will only discuss about the leukocyte recruitment or extravasation. So what is the definition of leukocyte recruitment? Leukocyte recruitment to the sites of inflammation is the process of migration of leukocytes from the lumen to the site of injury in the extravascular space. Here, these leukocytes perform the key function of eliminating the offending agents. The most important leukocytes in typical inflammatory reactions are the ones capable of phagocytosis, namely, as I have already said this earlier, neutrophils and macrophages. Okay, these leukocytes ingest and destroy bacteria and other microbes as well as necrotic tissue and foreign substances. Leukocytes will produce growth factors that aid in repair. Now, let us focus on the steps of leukocyte recruitment. So there are three steps. This process occurs in a three step. The first one is in the vascular lumen. The second one across the vessel wall and the endothelium, and the third one is the outside the vessel wall. Okay. So in the vascular lumen, there are also three steps. The first is the margination, second is the rolling, and the third one is adhesion. So now we have to learn how the process, this extravasation steps are occurring in the vascular lumen. As I have said, there are three steps: margination, rolling, and adhesion. Let us focus on the margination step. Okay, so during the margination step, what is first occurring? There is, due to inflammation at the site, during inflammation, when the blood flow slows down, there will be stasis. As stasis is occurring at that site, leukocytes, mainly neutrophil, move towards, in the second step, leukocytes, mainly neutrophil, move towards the peripheral column and as a result accumulate along on the endothelial surface of the vessels. So as a result, the whole process of leukocyte distribution is termed as margination. Okay, so let me repeat this. During inflammation, there is a stasis process, then leukocytes move towards the peripheral column, then accumulate along on the endothelial surface of vessels, and as a result, the whole process of leukocyte distribution is termed as margination. Okay, now let me come to the second step of inside the vascular lumen, which is known as the rolling. This is a very important step. Okay, so what is occurring in this rolling step? Marginated leukocyte, which has came to that part, injury part, in the previous step of margination. Those marginated leukocytes are able to detect and react to changes in the endothelium. Initially, they attached weakly to the endothelium, detach and bind again. So just focus on this point. Initially, they attached weakly to the endothelium, then detached, then bind again. Okay, with a mild jumping like movement. It causes rolling of leukocytes along the endothelial surface. Okay, so this is the whole process of rolling in the part of inside the vascular lumen. So what are the molecules involved in this rolling process of vascular lumen? The molecules involved are selectin, which mediates initial weak interactions between leukocytes and endothelium, and the second part is the chemical mediators like TNF, a tumor necrosis factor, interleukin 1 and chemokines. Okay, now let me focus on the third step of inside the vascular lumen, which is adhesion of leukocytes to the endothelium. As we all know, endothelium gets activated and leukocytes bind more firmly and finally come to rest at some point. They resemble as pebbles over the endothelium, pavmenting, and a bloodstream runs without disturbing them. So, as I have said this earlier, inside the vascular domain, there are three steps, and as we all know, the margination and rolling, how this process, the last two process has occurred. Now, in the adhesion process, there will be adhesion of those leukocyte on the endothelium part. Okay, and this will look like pebbles or pigmenting process like, and a bloodstream runs without disturbing all those leukocytes. So, what are the molecules which are involved in this adhesion of leukocytes process? Okay, the molecules integrity and corresponding ligands integration, ठीक है, and molecules mediators involved TNF and interleukin 1. Chemokines or chemoattractant cytokines cause conversion of low affinity integrins on leukocyte to high affinity state. This will help by chemokines or chemoattractant molecules. Now, as I have mentioned this earlier, the whole leukocyte recruitment extravasation process is basically happened in the three steps. The first one in the inside the vascular lumen, second across the vessel wall and endothelium, and the third one is the outside the vessels. Now we have to, as we have already known what are the steps inside the vascular lumen, now we have to focus what is happening across the vessel wall and endothelium. Okay, so what is exactly happening across the vessel wall? There are two steps: transmigration or diapedesis, and the second one is the migration across the basement membrane. So let us focus on the transmigration or diapedesis. Leukocytes migrate through the vessel wall by squeezing through the intercellular junctions between the endothelial cells. This include a member of the immunoglobulin superfamily called CD31 and platelet endothelial cell adhesion molecule 1. CD31 and platelet endothelial cell adhesion molecule 1. This include a member of the immunoglobulin superfamily. Okay. And the next part of this across the vessel wall and endothelium process is migration across the basement membrane. Leukocytes penetrate the basement membrane of the vessels by secreting collagenase. Now, as we have already known what are the steps occurring in the vascular domain and across the vessel wall and endothelium, let us focus the steps occurring outside the vessel wall. There are two steps: chemotaxis and accumulation of leukocytes at the site of injury. Chemotaxis is a very important step outside the vessel wall. So let us focus on the definition of chemotaxis. Chemotaxis is defined as a process of migration of leukocytes toward the inflammatory stimulus in the direction by the gradient of locally produced chemoattractants. Okay. Now, what are these chemoattractants which is helping in this chemotaxis process? The chemoattractants are exogenous and endogenous. Bacterial products in formyl methionine terminal acids, and the endogenous are cytokines like interleukin 8. Complement components also help in this chemotaxis process, which is C5a, C3a. Arachidonic acids and metabolites of lipoxygenase pathway like leukotriene B4 also help in this process. Okay. Now, the second step in this outside the vessel wall is adhesion of leukocytes. This is achieved by binding of leukocytes to the extracellular matrix proteins through the integrins and components like CD44. Now let me inform you what are the clinical importance of leukocyte adhesion molecules. Three main types of leukocyte adhesion deficiency have been identified. All are transmitted as autosomal recessive disease, characterized by the inability of neutrophils to exit the circulation to sites of infections, leading to leukocytes and increased susceptibility to infection. Okay, so this is the whole thing about the leukocyte extravasation or leukocyte recruitment. After that, I will show you in a diagrammatic manner how this process of inside the vascular lumen is actually occurring. As I have already told you about the margination, rolling and adhesion, I will show you this in a diagrammatic manner. And in my next video, I'll discuss about the leukocytic cellular events, in which I will discuss about leukocytic activation. Thank you.